I'm going to talk about tuberculosis. Yes, you've heard about tuberculosis. It's an infectious disease that mostly affects the lungs. We should also know it can affect the skin, it can affect the brain, it can affect the spine, it can affect the kidneys, but mostly the lungs. Now, it's an infectious disease caused by bacteria, easily treatable, easily preventable. So I'm going to talk about it briefly. Number one, about one quarter, that is 25% of the whole world, has had tuberculosis infection in the past. But not everybody that has the infection develops the disease. Now, of the infected people, about 5 to 10% of them will eventually develop symptoms and have the disease. So, what are the risk factors? Number one, smoking tobacco. Number two, if your immunity is reduced, that is HIV/AIDS, for instance. Number three, if the person has uncontrolled diabetes, and also this person is malnourished. What are some of the symptoms? This person has prolonged cough. You're coughing in long periods. This person has night sweat. This person has fever, maybe fatigue, maybe be weak, may have chest pain. This person may notice that they are losing weight. Go to the clinic and do a screening. The treatment is easy. Antibiotic for up to 6 months. You must make sure that you complete your course. Now, how do you prevent it? Number one, if you have been diagnosed to have tuberculosis, cover your mouth when you cough. Wear masks. Wash your hands regularly. Any product you use to either catch saliva from cough or sneeze, discard it properly. Stay in a well-ventilated room. If you work in a place that you have contact with tuberculosis people, make sure you get screened. Make sure you protect yourself. Make sure that if you have HIV/AIDS or AIDS, get screened, go and test. Avoid overcrowding. Make sure your room where you're staying is well ventilated. There's cross ventilation. And also for the children, make sure they get the full vaccination for age for those children. We can prevent tuberculosis. We can live through it. I'll see you guys on the next one. Bye-bye.